consistently you do well. Your patients appreciate what you do. They talk about it in the surveys, and really it's a consistent piece. So it's not just one good month, 2 good months. I mean, you really do some good work. So I'm asking you, what is your approach? I mean, what is your approach to patient-centered care? Talk me through it.
I think around here we kind of stick to, we still treat them like people. We treat them like they're our family. We treat them like they're our friends next door. I mean,
half of them are.
Yeah, half of them really are in a rural community. But rather than making them feel like just a number, they're just another notch in us making our goal for the month or for the year. We actually give them that care of, we care. So I think that's usually what keeps them coming back to us, and understanding that we know where you're coming from. We show them that compassion.
The compassion piece is a
Yes,
big piece.
We show them that compassion, and that you're not alone in something. We got your back.
What I was going to say is we treat our patients like family. We make sure that if they're concerned about something, we're concerned about it too, until we figure out the root of the problem or find somebody who can. We make sure that we like the people that we send them to. We want to make sure that they're getting care by people that we know are going to be treating them just like we would.
So you both said something to the effect of treat them like family. What does that look like?
That looks like coming in the door, hey, how are you? I remember last time you were in, you'd said your dog was sick, or your grandkid was sick, or having something done. We remember that. How are they doing? Not our patient, but we remember that. How are they doing? Hey, I noticed you're walking a little different. You feeling okay? I noticed something's just a little off. You're just not acting like yourself today. Picking up on the little things, trying to make small talk. I think patients really respond to that when they, know that you care, not just about, hey, I'm here, they want my money. But, oh, they were actually listening and paid attention. I said something. So I think when they come in, just giving them that pat on the back, shaking that hand. Yes, we have those patients that when they come in, they go around the office and want to give a hug to everybody in here just because they're here. And they do. We walk them through, everybody gets a hug. So it just comes down to, there are those patients, even like family, you don't always get along with them, even though you try, but you make it work. And they still get the best care that we can give them.
So you treat them like family.
Mm-hmm.
And you make it very personal in that regard.
Yes.
And the other piece that you do is you're compassionate. So talk me through what compassionate care looks like for you.
Compassionate care for me, patient comes in, I'm feeling what they're feeling. I'm trying to help them work through something. Whether they come in, they're just having a really bad day in general. Well, hey, if I can get a smile, that's at least a minute from a smile that they didn't have a bad time. They're upset, health-wise not doing well. I feel compassionate even if somebody comes in and they're having a great day. It's, yay, let me be excited with you. It's just feeling what they're feeling, giving them what they need at that time, whether it's a little bit more care, a little bit more comfort. To me, that just is my way of showing compassion to them. Just feeling what they're feeling, being with them in that moment, and helping them through if we can.
Same thing with you, Shannon?
Yeah, call, check up on them as much as need be. Some people don't always like to call and let us know what's going on, so you put a little extra note by your computer, hey, call so-and-so tomorrow because they're not having a good day or they're not feeling well, and they don't like to come in and tell us that they're not feeling well, so you call them back and make sure that they're doing all right. I know at one point we had a nurse that took a patient home on her lunch break because she didn't have anybody to get her home, and the van wasn't able to run that day for some circumstance.
It's hard, I think, when you get into a business side of it, to think of people like that, is that they're just a number. Well, they're not. They're still human beings. They still have feelings. They still need that care. They still need somebody to back them up. And I think that's kind of where we come in, trying to work both sides of, yes, we need to be business, and yes, we need to get numbers, but at the same time, taking care of that patient kind of trumps everything else.